I'm Thomas Baldrick at ASH 2015 in Orlando. Happy to have with us Dr. Alex Spyropoulos from the North Shore LIJ Health System. Thanks again, sir, for coming by.
Always a pleasure to be here.
Always a pleasure to hear what you have to say. Let's talk about another study of yours on the duration of anticoagulant treatment and patient outcomes. What do you tell us as an overview for this work?
Well, this is an important work using the PharMetrics database. And what we did is we queried the database from about 2009 to 2012. And we queried about 80,000 patients worth of data. And what we found in the study is that in those patients who did not meet the American College of Chest Physicians or ACCP recommended duration of thromboprophylaxis, this is for an acute index venous thromboembolic or VT event, they had worse outcomes from an economic perspective. So they had greater VT-related hospitalizations as well as all-cause hospitalizations on the order of about, again, $3,000, $2,000 per patient. And we used a cut point or cutoff of 3 months for provoked VTE and about 6 months for unprovoked VT. So indeed, if you don't practice ACCP recommended duration prophylaxis, it has adverse outcomes in terms of hospitalizations and then adverse outcomes to the health system in terms of increased cost.
How much better is it, in your opinion, to be able to work with such higher volumes of patients in doing a study like this?
Oh, I can't tell you the advantage of using these large databases that really you can start slicing and dicing the important questions to be asked. And I think what's fascinating in this particular study is that the vast majority of patients were on warfarin. So the suspicion, though we couldn't prove it as yet, but I think it's interesting for future studies, is that it's because in this generally younger, less comorbid population, they didn't want to deal with all the aspects of warfarin management, including frequent INR measurements, quality of life, dietary issues, drug-drug interactions, etc. And I suspect it's both at the patient as well as provider level, though that needs to be determined. Again, the suspicion is if we transfer this study and we move this forward into a direct oral anticoagulant or DOAC population, maybe we'll get much more adherence to the recommended durations of secondary thromboprophylaxis, which would then have downstream effects in terms of reducing costs for patients.
What would you believe key takeaways are from this study?
I think the key takeaways is that not adhering to the recommended duration of secondary thromboprophylaxis has repercussions, both with respect to patient-related adverse outcomes, but also for health system-related costs.
Very good. Thank you, sir. Congratulations on your success.
Thank you very much.
Okay.